Hi, this is Josh, pharmacist with pharmacisttips.com, here with a brief overview of the medication Simvastatin. Simvastatin is a medication known as an HMG-CoA reductase inhibitor. Typically, we refer to that family simply as statins, so this is a statin. In the U.S., it's sold under the brand name Zocor, used to treat hyperlipidemia, so high triglycerides, high cholesterol. It's used for the prevention of cardiovascular disease as well as events, so used to reduce the risk of heart attack and stroke. And it's also used for familial hypercholesteremia, and that is a genetic disorder that can result in high cholesterol. The dosage, it's available in 5, 10, 20, 40, and 80 milligram tablets. Typically, we're going to see that initial dosage in the 5 to 40 milligram range once daily in the evening. Dose is then adjusted every 4 weeks based on labs. This can be taken with or without food, and it does seem to be best in the evening. And currently, the max dose is 40 milligrams. So even though there are 80 milligram tablets available, that dose is not recommended anymore. Just increases the risk of problems. However, if people are stable on that 80 milligram dose, often they're kept on that. Potential side effects. Typically, less than 1 in 10 have problems with simvastatin. Those potential side effects can include stomach pain and diarrhea, constipation, nausea, headache, rash, and muscle pain. Rarely we can get severe muscle pain and damage, as well as tendon rupture. Some of the warnings we need to watch out for, of course, that muscle damage we talked about. We need to be mindful of kidney problems. It can rarely be toxic to the liver. Increased risk of diabetes. There is some concern that statins can increase the risk of developing diabetes, type 2 diabetes. At this time, they've determined that the benefit of the statin outweighs the risk of the diabetes. Over time, that may evolve, and so we'll keep an eye out for future studies on that. It can interact with other medications, so we need to be certain that our healthcare providers are aware of all the medications that we are taking. And we want to avoid excessive intake of alcohol with simvastatin. That can increase the risk of especially the liver problems. So just a few key points again. And it's not for use during pregnancy. We want to minimize that alcohol intake to reduce the risk of liver problems. Watch for interactions. We need to let the doctor and pharmacist know not only our prescription medications, but over-the-counter medications we're taking that could potentially interact with us. And see our provider for regular labs. Appreciate you watching. I would appreciate it if you like and subscribe. Thank you.